please inform them about the topic and the page number. Record maintenance is the chapter 7, and it's on page number 55. Records maintenance on page number 55, chapter 7. So if anyone is joining late, please help them out with the topic and page number. So medical records, in the sense, can anyone just, only two of you are there in the meeting. Anyone can just say, what do you mean by medical records in your own term? Okay, briefly, can you just say? I guess it is very self-explanatory. So medical record, what do you mean by that? Yeah, it's basically documentation. Okay, documentation from admission to discharge, everything, whatever actions you partook for the care of patient in treatment, diagnosis, investigations, etc. Okay, everything is documented. That is what we call it as medical record. So it has various function. I have listed out the few functions here. It's just the short form of what is given in the textbook. Okay, on page 55. So the first is the clinical assessment. Clinical function means to document the clinical assessment, what plan you have done, management plan, clinical management, nursing management, pharmaceutical management, okay, and how is the progress of the patient, okay, that everything will consist, will come under the clinical records. Then you have communication. Obviously, medical record will translate the communication from one medical staff to another medical staff. They do not have to individually go and speak face to face and say everything about the patient. If the medical record is passed along with referring doctors and consultant, all the evidence and all the communication which needed to be given on to is satisfied by the medical records. Okay, then you have legal aspects. Some medical records we do have to classify them as medico-legal medical records. Okay, so it has a legal aspect as well as any medical records, irrespective of it being medico-legal cases. Irrespective of that, all medical records can be used in the court of law, especially when a patient is suing the hospital or the doctors for malpractice or any negligence, etc. So these records form the basis of that case. Okay, then training, especially in all the medical institutes, right, for training the students, and for research, obviously, all the clinical research, epidemiological research, everything, where you can't go and meet the primary source of data, medical records are the secondary source of data of what all information you need. Okay, so it helps in research and training of students. Auditing, medical audit is completely based on the medical records, how it is kept, the completeness of the medical records, okay, and the accountability of the staff who is giving inputs into the medical records. And for future, it is very important, what and what we can anticipate in from the future health problems, etc. Okay, so now we have a pandemic based on all the COVID cases, those were admitted in the hospitals. Okay, based on that, in future, if we see a new strain or new virus or any flu which is coming up, because of the past dealings with the COVID virus, we have a record of that, how to go about it. Okay, so it will also form the SO, the standard operating procedure, okay, that we can note it down. And epidemiology. Epidemiology is the study of the population in terms of healthcare and other statistics. Okay, so medical records will help in that. So these are the basic functions of medical records in brief. Okay, the history of medical records earlier in the ancient times in India, the medical records were basically written on wood. Okay, it was carved into wood. You must have seen the ancient books, how it used to be. It was not made up of paper, it was made up of wood and certain natural items. Okay, so that was how medical records was kept in India. But later, with the evolution, with the allopathy coming into existence, Western medicine becoming so commonly used, okay, now most of the medical records in India are still paper based. We have not completely jumped into the entire computerization of the country. We are still in the middle somewhere. Okay, but very far off from complete digitalization. Okay, so that's the brief history about medical records. It is given from page number 55 to 56. You can just read through that. Then types. There are personal records, impersonal records. Okay, personal records are for all purpose records, and impersonal records can be used for research or statistics. Okay, for wherever if a patient's consent is required to make use of medical records for research purpose, or to study, or to give it to other doctors to study about the cases. Okay, in such cases patient's consent is required. Okay, so personal records, the hospital can use it based on the patient's case. Okay, from one department to another department they can use it for billing purpose, for pharmacy. Okay, when referring to physiotherapist. Okay, when the record goes from the inpatient ward to the physiotherapy center. Okay, there the physiotherapist can completely go through the patient's record. So that is for personal reasons for the hospital. In personal means you may have to take the, in some cases you may have to take the consent of the patient if their medical records are going to be used for research purposes. Okay, then you have paper records. They are very conventional. Okay, it is very popular in India. It is a very popular way of recording medical data in India still. Okay, you do not require special skills, okay, to write down what is actually taking place in the patient's mode of care. Okay, paper records, records are very easy to note down the information. You do not require any special training, you do not require computer skills for that. Okay, and there is no standardized method of recording if the doctor's handwriting is eligible or not. That's a drawback. You have few cons when it comes to paper records. Doctor's handwriting may be eligible, it takes a lot of space, it consumes a lot of space. Okay, and if most of the time it is incomplete and inaccurate, and all those inaccuracy in terms of medical condition, the MRD people can't trace that out. Okay, so accountability is very less when it comes to paper records. And if there is a chronic patient, okay, it's a chronic treatment center, tertiary treatment center, etc., each and every patient record can be so bulky that it can consume a lot of shelf space. Okay, so that's a concern here. And also when it comes to paper records based on OPD visits, if the patient is supposed to bring their file with them, sometimes the patient can lose the file. They can lose their OPD file at their home or anywhere. Okay, so it is very impossible to track down. Okay, where they may have lost and what was the previous history. Okay, it would have been very impossible to track down. It's an add-on work for the physician. Okay, in the follow-up visits, etc. So patients can lose it. Okay, paper records, medical team can lose it from the hospital. It can get damaged or destroyed if not stored properly. Okay, physically it is, if it is not stored properly, it can undergo certain damages. Okay, then you have computer based. Evidently it is much more efficient than paper records, but you require certain basic skill training in terms of putting the data into the computers. So the senior most doctors, okay, the senior most doctors, it is very difficult for them to incorporate this new computer skills into their practice. So now all the medical colleges have made sure that they have a subject of computer and information system in the MBBS syllabus. Okay, not just in MBBS, even in nursing, pharmacy, physiotherapy, uh, compulsorily they have a hospital information system as a subject, so that at the college, at the basic professional level itself, they get at least the basic skill training to understand the difference between medical records and electronic medical records, electronic health records, etc., to understand the basic difference between all these things. So that kind of training is imparted. As of now, it is imparted in the college level itself. Okay, so that these students, when they become future doctors, it is not difficult for them to use electronic medical records along with their medical practice. So that's the different types of medical records which we have. So paper records, it is comparatively inefficient. As if you compare paper records to electronic records, it is comparatively inefficient. Okay, there is a possibility of misfiled information. I told you accuracy. Okay, you can't hold anyone accountable with regards to the accuracy if it is not checked on the spot. Okay, so no easy access to data, information is difficult to share. Okay, between hospital to hospital, if you have to share that information, either you have to fax it or send a copy of it along with the patient. Okay, but when it comes to electronic records, it is very easy to draft an email with the content, with the PDF content of the patient's medical record, and just send that file to the respective physician or a doctor. It is much more easy to share data among the hospitals and physicians. Okay, so it is comparatively more efficient than paper records, electronic records, or computer based records. So, essentials of um, medical records. Okay, so when it comes to inpatient, can any of you just mention what are the important things that you will find in a medical records? I hope you must have gone through even a single medical records in your career. Okay, so what do you remember from the content of the medical record? What have you found? Okay, which was very common among all the medical records, especially the inpatient medical record. What do you find? What kind of information is there? From which and all area you will get the information in a medical record? When you physically see a patient's medical record, what kind of examples can you give? What will be the content of these medical records? Any example? Yeah, family history like allergy, medications taken, immunization. Basically, the patient's health history, family history, investigations done. Okay, investigations done. um, what complaints the patient had in their own language. Okay, subjective data and objective data. Subjective data means what the patient is saying. Okay, I feel pain here, I feel pain there, I am vomiting from the past few days, past few weeks. Okay, what kind of complaints the doctor the patient has stated in his or her own language. Subjective data should be there, and then objective data should also be there, what actually the physicians have found out. Okay, so those two different data should be there. Detailed history about their present illness, their past history, their family history, if any genetic condition is passed down the line or not. Okay, socioeconomic history. Okay, any history of bad habits like smoking, drinking, like that. Okay, immunization history when it comes to kids, pediatric patients, immunization history, and what kind of diet they have, non-vegetarian, vegan, vegetarian, etc. Okay, physical examination from head to toe, detailed physical examination, what diagnoses are there, what investigations you are planned. Okay, and what are the results of the investigation. Okay, these final diagnosis, change in treatment, referral, consultations required. Okay, everything will be there in an inpatient record. Okay, so that's the constituent features of the inpatient record. Then you have risks and a warning. Whatever, for example, if you have seen a TPR chart, okay, temperature, pulse, respiration, and BP chart, okay, the nurses will maintain that on every day at least 3 to 4 times. There are specific time within that time. Every morning 6 o'clock, then 10 o'clock in the morning, but then mid afternoon, evening, during the snack time, at night. Okay, these 4 to 5 times the nurses will go and check the basic vital signs of all their patients, and they will note it down. And it is told that for temperature they have to use red ink, for pulse they have to use blue ink, for respiration they have to use green ink. Okay, such kind of pens, different color pens they have to use to understand, to make sure, just even when the doctors come for rounds, just by looking at the TPR chart, the doctors will get an idea. Okay, where their vitals are fluctuating. Okay, and when there are warnings like any food allergy, any drug allergy, known drug allergy, etc., should be marked in red, or it should be written in red. Okay, so all the risks and warnings regarding to the patient's health. Okay, food sensitivity and sensitivity reaction, etc. Okay, everything should be marked in red or in some colors which can be very highlighting. Okay, so that the doctors do not miss that sort of information. Then you have a BHT, that is the bed head ticket. Bed head ticket is basically it's a data sheet. Okay, it will consist of around 3 to 4 pages maximum. It should not be too bulky. It should be very compact information from the admission to discharge or referral. What all things you have done, concise, in a concise form. In briefly, every all the details should be there. Okay, usually we call it as a discharge summary. In some hospitals you will call it as discharge summary. Okay, so name of the patient, their age, sex, address, provisional diagnosis, date and time, doctor signature, along with special name also, and registration number also. Okay, it has to be there. And this bed head ticket is given to the patient when they get discharged. Okay, so they don't go home with bulk of papers. Within 2 to 4 papers, it all the information is there from the time when they got admitted, what complaints they had, what were the diagnosis, investigation, not all the investigation, key investigations which led to the identification of diagnosis. Okay, that kind of information concerns what all drugs have been given, what drugs they have to continue to take, what kind of diet they have to follow after discharge, etc. If within 3 to 4 pages it is written down or it is printed down, it is given to the patient. That is bedhead ticket. Okay. Then surgery. Any idea what all the things which we have discussed in the inpatient features? Obviously, it will be there. What else will be there in surgery? What extra can expect when you see a surgical medical record? Anyone? In a surgical medical record, what kind of extra things apart from what we have discussed in inpatient records, what extra information you will find? If you have studied, if you are prepared with infection control examination, you would know. If at all remember WHO's surgical safety checklist. Yeah, pre-operative details, like before giving anesthesia and before you take the patient to the operation theater, checkup will be done. Okay, so to see if the vitals are stable or not. Okay, and antibiotic will be given. Latex allergy is there or not? Okay, that will be taken care of. Yes, post-operative notes, anesthetic notes, pre-anesthesia, during anesthesia, and post-anesthesia. What all were the major events that took place? Main thing, what all equipments, what all instruments were used in the surgery, the count of the equipments and instruments used before surgery, after surgery, because there are cases when surgeons may leave certain articles within the hollow of the body. Okay, so that should be avoided. That is why we have surgical safety checklist, etc. Okay, so these pre-anesthesia checkup, post-anesthesia checkup, pre-operative checkup. Okay, site of the surgery, full name of the patient, IP number, everything will be there. Okay, that these are the main classical difference which differentiates a surgical record from medical record. Okay, and all the events that took place in the surgery to the actual time. Okay, timing is very important. At exactly at what time you started the incision, at what time implantation was placed, if it was an implant surgery, what at what time implant was placed, at what time suturing up started. Okay, all these main events to the exact time, it has to be noted down. Okay, that is the surgical medical record. Then you have discharge and transfer. Okay, either case can take place if the patient has completely cured himself from the disease, or if it is the patient is going to be referred to another hospital. Okay, so all the information should be concise and compact. Yeah, information should be enough that wherever the patient is going, the consulting doctor gets a detailed view about the past history of the patient, so that time they do not have to waste a lot of time again collecting A to Z information from the start. Okay, all the relevant information should be mentioned, and the entire discharge summary, when you are sending off the patient, it should be validated by a responsible clinician. Okay, drugs used have has it been signed? Okay, the mg, the route, okay, the dosage, okay, everything has to be signed. Diet, what diet plan the patient has to follow after the discharge, is it signed by a dietitian? Okay, the investigations done, does the investigation has the signature of the radiologist or what laboratory, microbiologist, etc. Okay, before discharge. So these all the areas has to be validated. So that are the information that should be contained in the discharge summary. Then you have OP record. Usually in India, OP records are maintained very poorly. Until and unless if the hospital has computerized OP records, in all the other cases, OP records, if it is not computerized, if it is still paper based, OP records are maintained very poorly in India. Okay, so all the procedures like what incision, drainage, or small OP surgical procedures which has been done has to be detailedly incorporated into the medical records. And what all investigations done, both numerical, textual investigation, everything should be recorded. It should be very clear and explanatory, and OP numbers should be noted down. No mistake should be made while making the OP numbers. Okay, reference to the doctor should also be written down if new refers. If you go to a general OPD, okay, from there you can be sent to a cardiologist OP or ortho OP depending upon your condition. Okay, so that also has to be mentioned. The patient came to the general OPD, but from there the patient was referred to so and so OPD, either within the hospital or outside the hospital. Refer has to be mentioned. Okay, so allergy, sensitivities, everything has to be mentioned in the OPD card. Usually the patient will lose the OPD card. So provisions to have a copy of that within the hospital, or at least incorporate electronic medical records for OPD, is the best possible solution for mismanagement. Then medical legal aspects. Patients are the actual owners of their medical records. You have to remember that patients are the actual owners of their own medical records. So whenever medical records needs to be given back to the patient, if the patient will ask, they want their medical record back based on a reasonable charge, you can give their medical records back to them. Okay, so that the law cannot prevent that. Okay, so other than to the patient, you should not uh, give the information of the medical records from the medical records to anyone except without the consent of the patient. You cannot give the information out. Okay, so there are few areas where even without the consent of the patient you can give out the medical records. Usually it is when you're referring to another doctor. Okay, when the patient is ready to go to other doctor, you can automatically, it means that medical records can be transferred. Okay, and if the court of law asks for the medical record for any criminal liabilities, etc., even without the consent of the patient, you can give it to the court of law. And for consumer protection cases, okay, consumer protection cases, you can give the medical records. And if police or other insurance companies require medical records before reimbursement or any other cases which is going on, in that case it has to be given back. Preservation of records, ideally, there is a safe policy suggested for OPD records. It should be at least 5 years. All the outpatient records, inpatient records should be preserved for at least 15 years, and all the medical legal cases should be preserved. Here they have given 20 years, but usually if you go to a hospital and see it in practice, medical records, medical legal records, okay, medical legal cases are preserved for the entire life. Okay, it will not be discarded. Medical legal cases will not be discarded. Okay, so that's about the preservation. Any doubts in this topic? It's a very small topic.